Hello, friends. Hi, good evening. This is Dr. Vinayak Rangan, and I'm the founder of Mortimer Green. And we are one of India's largest platforms for MRCS preparation. So today's session is going to be about MRCS Part B. So you can ask me anything. And before we start, I would like to, start off with a little bit of information about how the MRCS Part B exam is structured. So the MRCS Part B exam, as you all know, is an exam which you would take after your MRCS Part A exams. And it's an exam where you're allowed 4 attempts. And the examination per se has 17 marked stations. The term marked is pretty important over here because there are going to be preparatory stations as well. So, and each of this is going to be for about 9 minutes. You will have about 1 minute to read the stem. And it is split into 2 circuits. So the one circuit is called the applied knowledge circuit, and the other one is called the applied skill circuit. The applied knowledge circuit has 8 stations for 160 marks, 20 marks per station. And the applied skills has 9 stations, again 20 marks per stations. So the applied knowledge has anatomy and surgical pathology 5 stations, applied surgical science and critical care for 3 stations, applied surgical skills has clinical and procedural skills for 5 stations, communication skills for 4 stations, which includes history taking, giving, and receiving information. We'll talk about that. I'll be clearing all your queries during your Ask Me Anything and as the session progresses. So a little bit about anatomy. Anatomy, they are going to give you images. The old habit of keeping dissected specimens is not done anymore. When I gave my Part B in 2018 in Colombo, it was one of the last stations where they used to have a separate dissected specimen. Now they will give you only, images from atlases. Sometimes they might give imaging images. They might keep images of what you would say, vascular anatomy. They might keep a CT angio. That's all possible. And there'll always be usually some sort of a clinical scenario. A classical clinical scenario is they would keep an image of a CT angio of the lower limb, and then they will say a butcher cut his thigh when a knife fell on his thigh, and what are the vessels that are likely to be injured. Then they go on into the vascular anatomy. They might go into varicose veins. So the anatomy can go into the anatomy of the musculature, anatomy of the arterial anatomy, venous anatomy, lymphatics. That is a direction which anything can take. And during all those stations, you're allowed to skip the questions and then come back to the questions. So, anatomy is literally the easiest station. You can score 100% marks. And I would say, don't miss scoring in anatomy stations. There's a lot of, and pathology. Pathology is also not too difficult. And we do train you for all these stations in our Part B courses. And I would say pathology and anatomy are some of the easier stations to handle. In the last few months or the last few years, the difficulty level of pathology stations has been increasing. They are going a little more deep into the malignancy part of it. So they're asking questions on lung cancer. They're asking questions on stomach cancer. And we can always brief you on what are the latest stations which are going to be asked in your exam. Applied surgical science and critical care is usually CRISP. They might ask you situations based on stroke. They might ask you situations based on DVT. They might ask situations based on critical care. So it's a varied spectrum. And again, we'll be training you in these stations as well in our courses. Applied skills is a challenge for most Indian, Pakistani, or international medical graduates. Because the real challenge is that you are not used to the UK system of examination. You're not used to the UK system of communication. You don't know how to sit. You don't know how to enter. You don't know whether you should scrub your hands. When a child is crying or when a patient is crying, you don't know whether to pat him on the back or whether to offer him a tissue. What sort of modality you would use for communicating your empathy, that is a little bit of a challenge. And usually there's 1 or 2 clinical examiners. Those are usually surgeons, trained surgeons, FRCS qualified. They can be local examiners. They can be from international. There's usually a eclectic mix. There are some people from the UK. There is a good number of people from the local station as well. So if you're writing an exam in Chennai, they're going to be FRCS examiners from Chennai and India, a significant amount of them. And there's going to be a good number of people who have flown in from the UK for the duration of 2 or 3 days of the exam. And then there's going to be someone called as a lay examiner. The lay examiner is the real challenge. Now, this is usually a person well-versed in English. Sometimes it can be the actor himself who's acting out the scenario where you're taking history taking. It's usually someone, a local English college professor. So, it's someone who's going to judge you based on empathy. He's not going to judge you whether you know your post-plenectomy vaccination protocol. He's going to judge you whether you convey the information clearly, succinctly, without using jargon. You should not say, your risk of, capsulated organism infection is going to increase. There's absolutely no point. You'll have to clearly indicate that, what kind of infection can set in, not just use jargon, which and it's a big challenge for us Indians because we've been in this medical system. Most of us have been surgeons for a pretty long time. Some of us for a pretty short time too, but we have been into this medical system for a significant amount of years. And it's almost as if medicine and surgery rules our day-to-day lives, which means that we tend to use medical jargon more often than not. Even if we do have spouses, many of our spouses themselves are doctors. That kind of creates a problem because, instead of saying left or right, we say lateral or medial. And I can totally sympathize with you guys when you use these terms, because ultimately it makes more sense to say medial or lateral, instead of saying left of this mic or right of this mic. But the common man, the lay examiner, doesn't understand this stuff. So you will have to use simple terms. You will have to use the language. And there is usually for these stations, if you don't know the local language, say, for example, you're writing the exam in Chennai, and there's a patient who understands only Tamil, they will keep a translator for you. But it is usually in most of the Indian stations, they have actors who are very conversant in English. But this might be a problem for those who are writing the exam in Malaysia, Colombo, Pakistan, for that matter. So clinical and procedural skills can involve tying of knots, drainage of an abscess, insertion of a catheter, and communication skills will involve communicating, getting consent for a surgery, handling a patient who's a Jehovah's Witness, handling an angry patient whose CT scan has been cancelled. All these are actual challenges which you would face in your real life and in your exam. So this is the marking pattern. So a little bit about the marking pattern, if you kind of look at it. Now this can go a little, aage-piche. There can be 4 anatomy stations and 1 pathology instead of 3 anatomy, or it can be 2 anatomy and 3 surgical pathology or microbiology. So there is usually 5 stations, anatomy and surgical pathology. And applied critical care and this thing, there's usually a critical care management station. There is an interpretation of clinical data, which is usually, it can be a patient scenario. And there can be interpretation of data, visual and lab. Now that can be ABG or ECG interpretation, or a patient with a whole lot of, scenario where there's a lot of clinical data, 5 to 6 pages of data, and that's something you'll have to interpret. Even in these stations, there can be a preparation station. There's usually 2 preparation stations. This marking scheme would tell you that it is mostly in the communication station where the preparation station is there, but it's not usually so. The preparation stations can also be there in the critical care management stations where you are asked to interpret data. So they give you about 9 to 10 minutes to prepare for these stations, and that's how you'll have to go and handle these stations. Again, communication skills, there's usually a communicating with colleagues where you will have to get an ICU bed, or you'll have to refer a patient to a higher center. And there's usually a talking with relatives or a patient, breaking bad news, taking consent. There are 2 history taking stations. Again, if you kind of look at this, there is a surgeon plus lay examiner. And in one of those communication stations, talking with relatives also, there is a surgeon and a lay examiner. There are 2 procedural skills, this thing, where there is a technical one, which is usually not time, and there is a patient scenario where it is usually involves drainage of an abscess or performing a knee examination, performing an examination of a hernia. But the fact is that sometimes instead of 2 procedural skill stations, it can be 2 or 3 even, and they might reduce those stations. And again, physical examination, 3 stations. One is usually a medicine station, one is an orthopedics, and one is a core surgery station. So just a small correction, in the procedural skill patient station, usually you will have a catheter insertion or a IND, where you will have to communicate slightly with the patient as well. I'm not getting into the details of how to do those stations because that's a whole session by itself. And I would advise you to come and attend our course. We conduct those every 2 to 3 months, and the latest one, next one, is going to be in March on 30-31 of this month at Gurgaon. And here's where we teach you how to approach all of these stations individually, how to sit in the front of the patient, how to sit in front of your examiners, how to address them, how to address the patient. When the patient is crying, do you get up, whether you offer them water? All this is covered in our stations. How to wash hands, how to talk, how to interpret an ABG, how to interpret an ECG. This is all covered in 2 days of intense workshop. Now that's going to be an intense workshop. So, if you do have the time, if you can spare 10 to 12 hours a day on that weekend, I think that's going to be absolutely crucial. We have conducted more than 10 or 12 of these workshops in Chennai and Delhi, and we have had a pretty excellent pass percentage when it comes to these exams. So how do you pass in these exams? You need to pass both of these exams, both of these circuits separately, the skills and the knowledge. And the pass mark depends on every exam. So it depends on the entire exam cohort, not just those people writing along with you on that day. It also depends on the people writing during that similar time in UK. So, during February, there's going to be a set of examinations all over UK and in the internationally. So, there's usually 3 cohorts: Feb, May, and October. So I think most of you might be writing for the, some of you might be appearing for the Feb cohort. Feb cohort is already over. Some of you might be writing for the May cohort. So some of you might be writing in Delhi, some of you might be writing in Birmingham, some of you might be writing in Manchester. So they combine all of this, and then there's a pass mark depends on the percentile of people passing. So usually what happens is that 70% of people pass. So the cutoff is usually around, the mark depends on what is the 70th percentile. So that can vary. There's a pretty complex system for understanding it. Simplifying it, take it as if 70% marks are needed to pass each circuit, and usually 70% of students pass every exam. How many attempts are allowed? So usually 4 attempts are allowed. Under extraordinary circumstances, 1 extra attempt might be allowed. If there has been some extenuating circumstances, including major illness or a major calamity due to which you're unable to prepare, and that's an exceptional. That is something you'll have to apply separately. And if you wish to cancel your exam, you should try to inform them as prior to them as possible, and you will have to give a letter from your consultant usually, or you will have to give evidence of why you had to cancel the exam. Is it a personal calamity, or I think some of you might have canceled for part A as well. So you might know this entire process. And if you have any doubts regarding this entire process, or if you wish to cancel your exam after you applied, don't hesitate to contact me. I will help you out personally. So again, ask me anything. So Dr. Sharath has asked me a question: how much preparation time is needed? To be honest, the time required for Part B preparation is much less than Part A preparation. Part A preparation, there's a lot of knowledge involved. And I would say that about 1 to 2 months is required for Part B. The real crucial part is how much time you spend on your course, because the course is the one where it covers most of this thing. In a 2-day course, whichever course you're attending, you will be covering the entire procedural skills, the entire set of communication skills. Almost all the stations are covered, the entire set of history taking. Because history taking, the art of history taking is more important than what kind of content you ask. So that's all I would say. So the preparation time needed is much less, but to pass Part B is much more difficult than passing Part A, because it's just not a matter of, how much information you're able to digest, but it's also about how much easily or with ease you're able to convey the information you have in your mind, how easily you're able to communicate. The university, so Dr. Shreya has asked me a question: does the university matter? Now, when she means university, I assume she means a college, and no, it doesn't matter. Some year the pass percentage in England might be higher. Sometimes the pass percentage in Ireland might be higher. So it really doesn't matter. But whatever Part A you applied, the Part B you apply for is what is considered for your degree. So for example, if you've applied for Part A through Edinburgh, if you do Part B England, the Part B England is what is considered as your final degree. So Dr. Sonalika has asked me a question: if India is not available as an exam center till September, should I book for a slot abroad? Yes, definitely. Many of our mentors, including Dr. 𝗪𝗿𝗀𝘀, who would be mentoring you in many of our courses, they have done their exam in the UK and they've done pretty well. We have had a significant amount of people who, especially during our COVID season, there were no exams in India, and all our students wrote in UK, and I must say very proudly, 90% of them passed. So how many times do they conduct exam Part B in the thing? It depends on the college. Usually there's an exam in Chennai, there's an exam, 1 or 2 exams in Delhi, England, and in Edinburgh. There might be exams in Kolkata, Hyderabad, Kochi. So this time. So Dr. Sunit has asked, when is your course available in Chennai? I really don't know. The next course will be sometime before the September exam. So you can expect a course around July or August. But I really don't know whether it's going to be in Chennai or in Delhi. We are not decided that. But the next course is on March 30 and 31 in Delhi. It's in Gurgaon at 𝗃𝐞𝐥𝐡𝐢 Hospital. So I have another question from Dr. Khan. As for anatomy part, does the examiner show you skull bones and ask for foramens and notches, or is it completely picture-based? I have not heard in the past 3 years, at least, anyone showing actual skull. It is usually only picture-based. But yes, skull-based anatomy is one of the favorite questions. So Dr. Akash has asked me a question. So if one is preparing for DNB general surgery practicals, will that preparation overlap somewhat with MRCS Part B? To be honest, I have not done the DNB practical exam. So though that's a question I will have to get back to you. I'll be posting this video on YouTube, and I will post this answer over there in the comments. But from what I have communicated, I have heard that certain parts do overlap, but I would say the preparation is almost 70% different. So Dr. Dilrup has asked me a question. Can one study for MRCS Part B in June and July while still preparing for NEET assist? Definitely. I mean, it really depends on what is your baseline preparation. For MRCS Part B, I would say 1 to 1.5 months, or at least 2 months of preparation maximum. 2 hours a day. So, if you're preparing full-time for NEET SS and you're spending 8 hours a day for NEET SS and 2 hours a day for MRCS Part B, definitely possible. I know of a lot of people who have done that, who still do that. But it really depends on your ability to multitask for sure. Theoretically, there's not much of an overlap. But yes, that's something you'll have to do. Dr. Vishnu has asked me a question. Can we clear Part B by practicing alone and while not being in a surgical job? If you prepare very well. I'm an MBBS graduate and currently working in a non-surgical job. Now, I've had a lot of people do that. I've had Dr. Abel Raju do that. I've had Dr. Gopika, who's been a mentor to a lot of our Mortimer Green students who have done that. But many of them have been in surgical jobs. I've had at least exposure to surgery. But preparing alone without going for a course, I would say that's the risk I would never take. So Sonalika has asked me another question. Is giving exam close to MS final exam a good decision, or should I wait? It really depends, because MS exam dates are pretty volatile. You may not get the date till the last moment. And I've had a lot of people cancel the exams because their MS exam dates have gone, exactly on the day of that exam, or, they have the practice just between theory and practicals. So that's the thing. Will you conduct any online session? See, I do conduct online sessions. We have conducted online sessions. But the fact is that most of the exam is based on how you behave, how you sit, how you dress, how you communicate, how you enter the examination room. And that I have found personally works very well in a setting where you are able to communicate to them, on a one-to-one basis, in-person basis. So don't mistake me, but I would say it's kind of difficult. So Dr. Mukherjee has asked me, will I be conducting a course in Hyderabad? Usually not. I would not be conducting. I mean, buddies, I think it's a very small world. I live in Jaipur. I'm doing my MCH in pediatric surgery. I mean, it's just a 2-hour flight from Chennai to Jaipur, 2.5 hours flight. It's literally to travel by road from Jaipur to Delhi, it takes me 4.5 hours with the traffic. So, I sometimes tend to reach Chennai faster than I reach Delhi. So I would say geography, if you're paying that much money for an exam, I would say take a flight, attend the course where it is. I don't think it really matters. But yes, if you're on a budget, if you're a resident, I understand that it's kind of a struggle. But I mean, that's a call you'll have to take. So in near future, I don't think we'll be conducting a course in Mumbai or Hyderabad or Bangalore for that matter. So Dr. Shea has asked me a question. If I graduate from one university while applying for FRCS, can we apply to all 3? See, usually FRCS is a very different situation. You will have to complete your MRCS. And it's not university, it's called as a college. And when applying for FRCS, it depends on whether you're applying for the joint college, international, or for UK based. International, I do have an idea. You apply through the JSCFE platform. Okay. After the exam, only you register in one of those colleges. So you can register in any of those colleges after the exam. So it really does not depend on which college you're applying the exam. So Dr. Khan has asked me one more doubt. For example, Part B exams are on 10, 11, 12 in London. The doctor giving exam on 11th will have same stems as 10th. No, not necessarily. There might be a couple of stems which overlap, but the fact is that you will have to understand that it really depends on your performance. Even if you know all the stations, the way you walk, the way you talk. Say, for example, there are a lot of MRCS Part B preparatory books about how to handle an angry patient. But literally let me tell you, that's one of the most difficult situations because you don't know how the patient will react. It might be the same angry patient, but the actor would be given two different instructions. In one, it might be a male. In another, it might be a female. Or one, he might tell that I'm very angry because you've operated on my son. In another, he might be very angry because you've operated on my wife. So this scenario can change completely. There might be a station on, say, brain infarct. In one, the set of questions might be completely different. So, you really can't expect that kind of this thing. A future course in Delhi? Yes, March 30-31, we do have a course in Delhi, in Gurgaon at 𝗃𝗐𝗙𝗀 Hospital. So how long after Part B can you apply for GMC registration is the next question. You can apply immediately. Obviously, you'll have to complete your IELTS and all that sort of stuff, the basic formality. You'll have to go through the IELTS website. You'll have to complete your ECFMG for UK. That formalities do remain. I'm not going to talk about it here because it's a complete different topic by itself. Dr. Vishnu has asked me another question. If I clear the September MRCS Part A, when can I expect to take the Part B at the earliest? If you're taking in September, say the exam is on September 1st, the results are going to come on November 15th, usually after 45 days after the exam. So I don't think you can apply for the, you will be in a position to apply for the February cohort, most probably. But the problem is that the centers do fill very quickly. So that's one issue. And you'll be able to apply only after the Part A result is there. The next question, repeats will be there, sir. I think it's a question. Yes, repeats will be there. But like I told you, repeats, you cannot just depend on repeats. Obviously, there's going to be the same set of about 10 stations in communication, but it depends on how you handle that rather than depending on the repeats per se. So Prachidi asked me, what is the update annual membership fees of the 4 Royal Colleges? I really don't know the exact fees breakdown, but it's around 15,000 rupees a year. Yes, it's about 15,000 rupees a year. What and where to study for my Part B examination? For communication skills, history taking, I would say attend the course. Procedural skills, again, for the same thing. For critical care, there's a 𝗃𝗐𝗀 manual which is released by NICE and it's available publicly. For anatomy, I would say there's a green color textbook called 𝗪𝗍𝗻𝗀. Absolutely amazing textbook. Read the same material you read for Part A and handle that textbook. For Part B, if you wish, I can share the material with you guys. For Part B, especially pathology and microbiology. Next Part B in India, there's exam in May 1st, I think, but the centers have closed. There's a center in Chennai, I think for July or June, I don't remember exactly. That's also closed. So Dr. Sunit has asked me a very interesting question, which a lot of people ask me. Any of the intercollegiate exams is easier compared to others for Part B, better pass percentage? Absolutely not. Some people will tell you Edinburgh is easier. Some people will tell you England is easier. It's all personal bias. Trust me, there's no difference. Sometimes it is England is better. Sometimes Edinburgh is better. Sometimes Glasgow is better. Last day, important things to revise for Part B exam. My funda is very clear. If for all stations, make a list of 10 important things in your mind and make them with your fingers. So, once you're in that station, for example, if you're taking history taking in a claudication patient, smoking history is one thing, family history is another thing. So, just keep ruling out this thing. And also make sure of note of important things such as, washing your hands, establishing a rapport, asking a short history. All the sort of things should be there in your mind. So Prachiti has asked me a question. Our registration is open for the Delhi course. Can we get the link? Yes. Ankur, would you be so kind as to post the link in the chat directly? And there's an MRCS Part B with MG group. If any of you need to join the group, details of the course are regularly put up in the group over there. And you can also talk to the people who have taken the course before if you wish to have, if you do have doubts, we will connect you to them as well. So yes, I think this course is open, registrations are open, and I'd be glad to have you there. I hope to see a couple of you over there. Yeah. So do we have any more questions? I think I will end my session with this. So I think more doubts will keep cropping up. I'll make sure I post the video on YouTube, and I'd be extremely grateful if you could, post your questions in the comments, and I'll be super glad to help you out, super glad to answer you. And I wish all of you all the very best for passing your MRCS Part B exams. For those of you who can do attend the course, it's going to be quite useful. See you in Delhi. All the very best.